DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. Glad you joined us today. We're going to have a great show. Our guest is Dr. Chris Blevins, who's an equine veterinarian and works at the Veterinary Health Center here at Kansas State University's College of Veterinary Medicine. We're going to talk about getting rid of those parasites in your horse. Stay tuned and enjoy the show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to the show. Chris, welcome back.
Thank you very much.
Folks, this is Dr. Chris Blevins. He's assistant professor and equine field service clinician here at Kansas State University's College of Veterinary Medicine, and always great to have you on the show. You do a great job.
Thanks.
Do a lot of great things here at K-State, and it's a pleasure to work with you.
Well, thank you. It's nice being here, and it's always a pleasure being around you.
I appreciate that, Chris. Parasites is a big deal with horses, and we talk a lot about worms and getting rid of worms and preventing them and different strategies and different products and things to that nature. I'm sure that you spend a lot of time in your practice and field service working on these types of issues.
Yeah, and it's one of those things where a lot of people, there's like old renditions of what you should be doing. You know, back in the 60s, a lot of people are still doing the same thing for deworming horses, and we found it's not necessarily what we should be doing now, but we still have the same worms. So.
Okay. Well, speaking of the worms, let's get into kind of, you've made a list out here of the different worms that we need to be concerned about, and ascarids and strongylus and different worms of that nature. Let's just kind of go down through them and talk about the worms and their effects.
Yeah, you know, with horses and the different type of internal parasites or worms, a big one would be ascarid type worms, and I think some people need to remember that ascarids usually only affect young horses, so usually they're going to be less than 3 years of age. They get an immunity to ascarids as they get older, but when we kill the ascarids, people have to be careful, because if you kill them all at one time, especially in these youngsters, they get ascarid impactions, colic, potentially could even die. So we have to be careful with those, and consulting with veterinarians and things of ascarids and how to get rid of them is going to be important with that. Sometimes they can even cough because of the ascarids. They migrate through the lungs, so that with horses is something to always kind of keep in mind too. The other one is strongyles, so small strongyles is the big one. A lot of resistance to some of the dewormers, but that's the big one that causes weight loss and stuff in horses. All the internal parasites mainly are fecal-oral transmission, so they're picking it up through their mouth, going through the GI tract, and coming out the other end in the feces. So I think that's something else to kind of keep in mind, especially with the strongyles. The other thing would be, you know, we have pinworms in horses, and sometimes they'll be itching their hind end on different things. And again, that's going to be a kind of oral transmission where they're rubbing on buckets. Somebody else picks it up from that bucket from when they're rubbing on it there. But rough and tail heads, those kind of things could cause that. And then donkeys can transmit lungworms. That's another thing that, you know, to other horses, and they can cough, but you don't necessarily have to get rid of the donkey, you just deworm the horse. So.
and deworm the donkey.
And deworm the donkey, yeah.
Make sure, yeah, because sometimes we sit there and, you know, you deworm the horses of more value, and you forget about the one out back, or the Shetland that you kept because the kids used to ride it, and it's a pet.
Yeah, and that might be the shedder. That might be the one that has the most worms.
So making sure that we get to that one, and making sure that we get to all of them. Any other things on the worms? We're going to have to go to a break here in a second.
Yeah, the other thing would be like bots. Everybody kind of is worried or hears a lot about that when they read their horse magazine, the stuff about bots and the little yellow eggs that are on the legs of the horse and get into the stomach and those kind of things. And really, main thing that bots do is a worry factor where they look like little bumblebees, these little flies that deposit the eggs on the horse's legs, and then the horses run around, and they can even jump in ponds during the kind of fall time, just trying to get away from them. It usually doesn't hurt them, but it's just kind of a nuisance, and so that's the big deal. Bots in the stomach, people have seen pictures of those before, just kind of have those aspects, maybe cause gastric ulcers, but there's dewormers that get rid of those too.
Perfect. Folks, we're going to take a break. When we come back, more with Dr. Chris Blevins on equine parasites.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Cody Ansbach, a student at Purdue University, recently received an AmStut scholarship. Originally from Winnemac, Indiana, Cody grew up around livestock and showed stock in 4-H for 10 years. His passion lies in production medicine with strong interests in preventative medicine and reproduction. After graduation, Cody plans to go into a dairy practice.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to DocTalk. Chris Blevins is with us today. He's assistant professor and he is the equine field clinician here at Kansas State University's College of Veterinary Medicine. Does a lot of good things in the classroom teaching, does a lot of things with our students, but he has a field service where you're going out and you're seeing horses, you're seeing cases throughout the Manhattan, greater Manhattan, Topeka.
Yep.
You're at horse shows, rodeos, all around the state.
Yeah, Dodge City, we go down Dodge City rodeos, so we travel a little ways.
That's great, that's great. So we're talking about getting rid of worms in horses, and so we talked about the worms, and you know, the next logical bugs than drugs. And
Yeah.
so
Yeah.
what are some of the dewormers that we're talking about?
You know, whenever there's a lot of dewormers actually out there for horses, at least options based on what people call them or companies give names to them. And there's aspects of daily pelleted dewormers, so they can just put dewormer in the food, and horses can pick up those dewormers daily. Is usually how a lot of those are. There's some that can be pelleted once a month type dewormers too, so it can be in the food, so they'll just eat it that way. A lot of them that are out in the market are some kind of a paste syringe. It's in a syringe, and they just paste deworm, put the horse, the wormer right in the horse there in the mouth, and that again can be different, and what places kind of recommend based on those things can be variable also. And whenever you look at those and some of those active ingredients that are in them, companies call them different things, but a lot of times if you just look at the active ingredients, they'll be very similar. One of the ones that's very common is ivermectin, and ivermectin is one of the most common ones that is a dewormer for the horse. We do have moxidectin that's also in some of the dewormers, pyrantyl pamoate, fenbendazole, and then praziquantel tapeworms. So horses can get tapeworms too,
Right.
and one of the dewormers that helps get rid of those is praziquantel, is the active ingredient that's in that.
So most of them, Ivomec are probably your most common, and the fenbendazole
Yep.
type dewormers,
Yep.
and I'm assuming that they all come in the different forms and opportunities to give to your horses.
Right, yeah. Most of the time, though, when you look at a lot of those different aspects, they come in a paste. The strong or the pyrantyl pamoate can come in a pellet, and some of those aspects of dewormers, but a lot of them are in a paste format, and usually with a combination. So, like an ivermectin praziquantel, that can be like a tape Care Plus or something like
Yep.
that. So there's different combinations usually of those dewormers too that are out there.
And I'm sure we'll get to it when we get into the next segment. But you want to make sure that you work with your veterinarian and develop. Can there be regional differences in parasites, or are they all pretty much the same around the world?
They're kind of, as far as the United States and a lot of places around the world, have the same type of internal parasites. So I think that's something else you just have to kind of keep in mind, that it's very similar through horses. They pick up the same type of worms, and there's a lot of speculations and different things that they could do to deworm, but yeah, it's kind of dependent on what they find.
Cool. We're going to take a break, folks. When we come back, more with Dr. Chris Blevins on controlling parasites in your horses. Thanks for watching Doc Talk. More after this.
I will take action against herbicide-resistant weeds. I will know my weeds, and I will stop them before they go to seed. I will do whatever it takes to give my crops the upper hand, and I will use multiple herbicide sites of action, because every action counts. I will take action, this time for all time.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. True Test Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with my friend and colleague, Dr. Chris Blevins, who is an assistant professor in the Department of Clinical Sciences and is our equine field service clinician here in the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. And Chris, we're talking about deworming the horses, and we got into, there towards the end talking about combination dewormers and using paste and pellets and ivermectin and fenbendazole. But one of the things I keep hearing about is resistance of the worms to the products.
Yeah, and I think that's something else that some people, they get overloaded by advertisement of all these products, and so then it's like, well, veterinarians recommend to deworm once a month, and you can get these deworming packages and all kinds of things. And what are we doing? And what we're finding based on some of the research is these internal parasites are becoming resistant to our dewormers that we're using. And so we need to back away from using all these dewormers all the time if the horse doesn't need it. And so to do that, usually what we're doing now is to recommend to run a fecal.
Okay.
And so take a fecal sample to your veterinarian, and then they can see what kind of eggs are in the feces and then make recommendations on the dewormers. In addition, you can deworm and see if that dewormer works by then taking a fecal back into your vet to see if there is resistance. And so that is something that's coming very common, especially here in the United States, because we're over deworming our horses that don't need it. So running a fecal.
So when we talk about, first of all, horses do a nice job of packaging.
Yeah.
You
Yeah.
pick up a hockey puck and you take it in and you get it run. But how long should I wait? Let's say that, and I agree, always work with your veterinarian on this, but how long should I wait from, let's say I want to see if I own a horse barn, and I want to see how long it is from the time that I start deworming to effectiveness. How long do you wait until you take that second sample?
Yeah, so it's always good to take the first sample prior to doing any deworming so you know how many number of eggs are in there, and then it's usually about 1 month.
Okay.
So 1 month after you deworm, then you take another sample in to see what the egg count is at that point. So that's kind of a fecal egg reduction test. So what is the numbers reducing to based on the dewormer?
We're doing some of that in the feedlot and in cow operations as well, so that you can see, come in there, and it kind of gives you a timetable and an opportunity to really see the efficacy within your herd or that. But and people need to realize that life cycle, that worm, 21 to 28 days, depending on the worm, that gets you clear through a life cycle and make sure you're working.
Correct. Yeah, so you just have to wait a little bit of time, then run the fecal again and see where you're at. Yeah.
Cool. When you're developing these plans, after you run a fecal, we talk about preventing resistance, and we talk about making sure that these continue to work, but it also saves you some money if you do it.
Yeah, that's right. I think that some owners, they kind of forget about that too, because if you're over deworming your horse or you're deworming every month, maybe you just need to deworm once or twice a year. And so if there's low fecal egg counts, then maybe all you need to deworm is just twice a year. And that's kind of mind-blowing for some owners because they're just not used to doing that, but that's really can save them a lot of money too in the long run.
Yeah, so when you start thinking about some of them that are doing it once a month or so frequently, it's something that could save them a lot of money.
Right.
Well, we've talked about the worms, we've talked about the dewormers, and we've talked about some of the prevention. When we come back, we're going to do kind of a wrap-up here with Dr. Chris Blevins, talking a little bit more about controlling parasites in your horses. Chris, thanks for being here.
Thank you.
Folks, thanks for watching. More after these messages. Hi there, folks. Dr. Dan from DocTalk. Are you BQA certified? If you work with beef cattle and you're not, you should be BQA certified. So if you work with beef cattle on day-to-day as a beef producer, whether it's cow-calf, stocker, or feedlot, whether you're working in an auction market, whether you're 4-H, FFA, or ancillary to the beef industry, it's something that you need to do, and it's something that you need to be familiar with. Beef quality assurance has been around for over 25 years, and it has been the cornerstone for education for producers about things such as antimicrobial residue avoidance, food safety, animal welfare, sustainability, castration, dehorning, and many different things. And today, this educational opportunity is not only available face-to-face through your state coordinator, but it can also be attained online through Beef Quality Assurance online training provided by Boehringer Ingelheim Vet Medica. If you go to the website bivi-bqa.com, you can be registered and certified in beef quality assurance at no cost between now and April 15th. Also, if you register and become certified between now and April 15th, you'll also be entered into a drawing to win a Yeti cooler and a barbecue package valued at $500. It's a great program. It's something that's been around for over 3 decades. It is the cornerstone to safe, wholesome, affordable beef. It's beef quality assurance. Get certified today.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Working your cattle just got easier. Introducing the new Vet Gun delivery system, a new way to apply topical insecticides to your cattle. The Vet Gun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML Vet Cap is used with the Vet Gun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. Vet Gun. Check with your animal health supplier for availability.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Chris Blevins. We both work here at Kansas State University's College of Veterinary Medicine, where Chris is an assistant professor and serves as our equine field service clinician in our veterinary health center at the vet school. And we're talking about deworming, and you're talking about tapeworms as we're in the break, about making sure right after the first freeze that you want to treat them.
Yeah, you know, some people, you need to understand that there's sometimes a secondary host that kind of picks up and transmits it, so then the horse can pick it up. So there's a mite that's usually out in the pasture where it carries the tape mite or the tapeworm. And so usually I tell people wait and deworm for tapeworms after the first freeze, because the mite doesn't usually do very well after it kind of gets cold and freezes in the pastures.
Cool. So I don't have to go buy these deworming products at the vet clinic, but it's probably important to make sure I'm working with the vet, even though if I'm not buying them from him or her.
Right, because I think that's something that some people, they just see a lot of advertisements on what they could buy out in the, the internet or wherever, and they can be packages of dewormers, and it looks great because you're saving money here and there, but maybe we're over deworming that horse and you don't need to buy the whole package type dewormers, or just buy this product or that just haphazardly. So working with your veterinarian and trying to figure out, this horse actually just needs dewormed once a year or twice a year. This horse had a high load, it's shedding it in the pasture, maybe it's going to shed it to those other horses. Let's deworm it more frequently. And so having those individual basis and testing can help you manage internal parasites, especially on farms or just the one horse in the pasture type deal.
You bet, you bet. Well, if people want to go and find out more, you've got some websites and some different places that people can go to. What are some of the things that you look at or that you've produced?
Yeah, and I think that a lot of people, there's great information out there. The AAEP, which is American Association of Equine Practitioners, they have a website. It's aap.org, and you can go and look and see what deworming guidelines. It's actually a very current one that they just wrote last year on internal parasites, what we should do, what you're seeing, and you can read a lot of information on there, and it's usually just access to the public based on that. And then you could always kind of do a search engine and just do KSU timely topic deworming recommendations, and it'll pop up through our website here at the vet school, and you can get some great information, what eggs per gram and those things that we kind of briefly discussed and how those go.
Perfect. Well, thanks for being on the show.
Yeah, thank you very much.
Great information as always, folks. Dr. Chris Blevins here at Kansas State University's College of Veterinary Medicine. If you want to know more about what Dr. Blevins and I do here at K-State, you can find us on the web at www.vet.ksu.edu. Remember, we always recommend that you work with your local practitioner. You've been watching DocTalk today. We're glad that you joined us. I'm Dr. Dan Thompson from Kansas State University, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.